In response to the recent declaration by the World Health Organization of Mpox as a public health emergency of international concern, the Ministry of Health, Wellness and Elderly Affairs is implementing precautionary measures and isolation protocols to protect the health and well-being of all citizens. Mpox primarily spreads through direct contact with an infected individual's skin lesions, bodily fluids, or respiratory secretions. Transmission can also occur via contaminated materials such as clothing, bedding, or towels that have come into contact with the infectious lesions. Symptoms include fever, headache, muscle aches, back pain, swollen lymph nodes, and rash. If you experience any of these symptoms, you are considered as a suspected case of Mpox and should seek immediate medical attention at your nearest healthcare facility or consult your primary care physician. Where possible, please inform the healthcare provider of your symptoms prior to arriving to the facility. During your visit, you will be tested for Mpox using swabs taken from skin lesions. Samples can be processed at the Ezra Long Lab in Saint Lucia. All suspected cases of Mpox will be isolated for a period ranging from 2 to 4 weeks. Depending on the severity of symptoms, individuals may be instructed to isolate either at home or in hospital. To mitigate the spread of the disease, persons on home isolation should isolate in a well-ventilated room and observe respiratory etiquette such as wearing a mask when interacting with other family members. When in isolation, you should not leave your home. In addition, frequent hand hygiene with soap and water or alcohol-based hand sanitizer should be observed, and skin lesions should be covered with long sleeves. Wear disposable gloves while cleaning and disinfect surfaces, equipment and high-touch areas using EPA-registered disinfectants, including bleach and hydrogen peroxide. Ensure the proper disposal of all waste materials when handling contaminated linens or materials. Based on WHO guidelines, there is no quarantine of contacts of suspected cases and no need for provision of sick leave to asymptomatic contacts. Close contacts should monitor for symptoms such as fever, rash, headache, and muscle aches for 21 days from the date of exposure. Contacts who remain symptom-free can continue with their routine daily activities and can attend work and school. Post-exposure vaccination is recommended within 4 days of exposure for a very close contacts of a confirmed Mpox case. Additionally, vaccination is advised for individuals traveling to affected regions in Africa. At this time, mass vaccination is not recommended. As of today, there have been no confirmed cases of Mpox in Saint Lucia or in the region. The Ministry of Health continues to maintain heightened surveillance for the early detection of any possible cases. The public is urged to remain vigilant and adhere to the current recommended health guidelines. The Ministry of Health, Wellness and Elderly Affairs will provide further updates as the situation unfolds and more information becomes available. For additional information or to report any concerns, please contact the Epidemiology Unit at 468-5325.